So head-on motorbike versus car towing caravan.
Good 101.
MFT's easy.
All moved to 10 for north. Bypass is on.
Dr. Chris and paramedics Sam and Lee are heading to the Yorkshire Dales.
Oh, good attack. What are we going to? Cyclist. What's the motorcyclist done about?
Brake stage.
James said he sounded a bit ratchet.
Ratchet.
Presume James Cook's near 70cc there.
Richmond, yeah, you brilliant.
It's 45 minutes normal road conditions to James Cook, 30 minutes to Darlington. So we're just going up to North Yorkshire, right to the northern point of Richmond. Reports of a motorcyclist who's collided with a car, who's got some serious leg injuries. Also, he's been described as being a bit agitated, so we're quite concerned that he may have other problems. We try our very best not to take agitated patients in the aircraft, because they are difficult to manage and can put a risk to ourselves and themselves. But there are a variety of drugs and techniques we can use, and of course, trying to calm the patient down to manage it.
The patient is amnesic. He has hip and leg pain, one leg's reported to be at a funny angle, and he has facial bruising and damage to his helmet. DCA has just arrived on scene. I've asked for an update for them. Thank you.
The coach stopped here now, just right below the back of us. That's the ambulance though, we've not seen. Should be. There's a bus. Because that bus was pointed that way and it stopped, hasn't it? I think they said it was on a bend actually, so I wonder if that's it. Oh, there he is. Looking. There is a field back behind us now. There's a field there, but. Okay.
Pilot Gary has his work cut out finding a place to land.
We can relocate, can't we? This clearing here, look, you got access. Oh, yes, you can, man, yeah. Can't see any wires, there shouldn't be any wires. I can't see why there'd be wires here. Clear the trees. That's the sheep have got Wi-Fi. Leaders aren't played out. Okay.
Yeah, this one, but it too. Yeah, we're just making his way up on foot. It's we're about 300 yards away.
There's not been a further update from the scene, but when we flew overhead, we got a visual casualty. Sort of lying on his back. It looks like crew see removed all his clothes already, which is a good thing for us. Helps us visualise any sort of like potentially just straight away windy road, so traffic seems to have also been stopped.
Local paramedics are already treating 27-year-old John Ray from Newcastle. His bike hit a van towing a caravan, catapulting him through the air.
John, 27, 69 an hour, depending on the drive.
Okay.
Did try to remove his own helmet, he survived, helped him, right leg's obviously no fracture. Chest clear entry, nice and clear, no chest pain. Bit tacky 105 when we arrived, that's his latest set of odds now.
Okay, let's have a quick look, but yeah, let's get ready to get him moved.
Yeah, he's got
Hi, John. Hello, John. My name is Lee. I'll stay off you 2 minutes, fella. Let's have a quick look at that. Oh. Do you know where you are, John? No, you're a bit confused, are you? Okay, stick your tongue out for me though. Yeah? Blink your eyes. Okay, alright. So whereabouts has hurt the most, John? Your lower back in your right leg, is it? Right, yeah, okay. Just go quick check it over again, John. Okay. Are you just come on your chest, John, at all? No? Just your back, is it? Well, you say your lower back or your upper back? Your lower back, is it? You will leave hands and toes for me, John? Wiggle your hands for me. Any pins and needles, anything like that? You can't wiggle your right foot? It's dead, is it? Okay, yeah.
First on the scene to assist John was teacher Lisa Hall, who was driving a school minibus.
I could hear that he was really struggling to breathe, he was gargling and it was kind of foaming a little bit at the mouth. So I took the decision to loosen the helmet initially, and we got his zip down a bit and tried to open the airway. First aid trained, it's part of the job, but obviously it's not, this is not part of the job, but you just help when you can. So things that you've heard, things that people tell you.
So cut the rest of your jacket off, would it?
As we were coming around the bend, the motorbike, his friend came around the corner, quite close to the white line, but I could see the yellow bike behind, and he kind of looked, he was going past, he didn't look like he was coming around the bend as such. And obviously I've been following the caravan and I've seen him go into the side of the caravan, and obviously he's come flying past me on the bus.
It looks like she saved John's life, but Dr. Chris fears that as well as a broken leg, he shattered his pelvis. If that's the case, his life is in danger from catastrophic internal bleeding. On a road in the Yorkshire Dales, the team are working on a biker badly injured when he was catapulted into the road after a collision with a caravan.
John, go put your legs straight, okay? It looks like it's already straight, innit?
Oh, it's not straight. I mean, if you have to get a visor on, you're going to have to soften it off anyway.
Yeah.
So I think we'll do some manual traction on it.
Yeah.
Get
Nice. It's on 3 when I come this way. Okay, speak round this way.
They're rolling him onto a spinal board to protect his back.
3, 2, 1.
Slide up 6.
John was out for a ride with a mate. He didn't see it happen.
Which way were you riding?
We're going that way.
You're coming down the hill, yeah? Oh, so you come round?
Yeah, so we're coming down here.
Right, okay. So, is he at the caravan there?
Yeah,
And he's ended up here?
front row, the front by
The front.
the ambulance.
So he's landed here? Were you behind him or in front of him? So he's absolutely, he's flown, hasn't he? Down. See how far he's come? So he's gone. He's out of. Yeah, lower back.
We're just going out for breakfast. Met over in Newcastle, came across the A69 and through Barnard Castle, and I believe there's a pub a few miles up the road, which we're going to go for food. It's quite a nice road. Obviously quite busy sometimes as well, as you can imagine, caravans, cyclists, that sort of thing as well. Just heard the crash behind us, unfortunately, and just turned around. Well, I pulled over aside at first, realised that obviously he wasn't behind us, and then I turned the bike around and then came back and seen him lying on the floor, quite far away from the bike.
John is critically injured, but the team have managed to restore blood flow to his leg.
Yeah, I'm not giving a ketamine yet.
The right leg looks definitely less ischemic. The camera ankle's still prolonged. And the time that we got being pulled backwards to 11.
It looks like it's quite a little femur fracture as well.
Yeah.
It looks not traditional.
I think ischemia was probably the ankle.
Ankle triad. He's had quite a substantial mechanism of injury, and he's some considerable distance away from actually the impact point. I would say at least 20 metres, lying in the middle of the road. The crew seemed to do a really good job, removed all his clothes, straightened his leg. But he's obviously clearly a bit concussed at the moment, keeps repeating himself.
The accident could easily have been fatal if it wasn't for the first aid skills of a member of the public.
I've got his helmet here, you can see he's sustained quite a substantial impact to one side of it. So initially he may have been unconscious on scene. So yes, she's done a really good job, yeah. This, if you've been knocked out, open someone's airway could be a simple life-saving measure when someone's unconscious. She's done the right thing, yeah. She's also done a brave thing as well. A lot of people, first thing they'll do is they'll ring for 999. They recognise that someone's critically ill or not well, and looking to intervention is sort of a very brave thing, and she's got to admire him doing that.
They're flying him to the major trauma centre in Middlesbrough. It's a 15-minute flight.
Posture is engaged. So there'll be some injury in Johnny's leg. He's got injury to his right leg. He's got a fractured femur. That's one of the major bones of your body. You can bleed about 2 litres into that fracture. So by putting in the splint and pulling it back into alignment, that reduces the amount of bleeding.
And Dr. Chris is full of admiration for the first aid that kept John alive.
Even the most basic of things, that really you don't need to be a paramedic or a doctor to do. Just knowing how to open somebody's airway by just gently lifting their chin, things like that can make a huge difference. And that's why we encourage that people are training first aid. Certainly many people do believe it should be part of a national curriculum through your driving test. Yeah, that's good.
It's time for the trauma team at the James Cook Hospital to take over the battle to stabilise John.
He's travelling at 60 miles an hour, riding his motorbike. He's at the front of a van, offside impact. He's then travelled 20 to 25 metres through the air and landed on the concrete. Pelvis, is intact, he's complained a lot of lower back pain, abdominals nice and soft. Obvious right femur fracture, which had been straightened prior to our arrival. Reports that he wasn't conscious on scene or quite dazed and stuff, tried to remove his own helmet. Blood pressure on scene was 130/90, but there's a few spurious forms, probably aircraft movements. He's had TXA, Gramorph, on Dansetron, 7 milligrams of morphine. He's fit and well and is on no meds.
Tonight, John will undergo surgery. His injuries could be life-changing.